Lung cancer nationally, it is the biggest cancer in the United States of America. 234,000 people diagnosed with lung cancer last year. The 5-year survival rate for lung cancer is only 26.7%. This is actually going up though. This is actually increased in 2021. The last time I pulled this slide, it was like 22, 23%. So we're actually making big strides there in this space. And the reason we're making those big strides, I'm going to talk about in a second. So these numbers are depressing at the moment. They're going to keep on getting better year after year there. The reason why these numbers are so bad is because we usually find lung cancer so late. We usually find it when people are symptomatic, when they're having a cough, they're coughing up blood, they're losing weight, when it's stage 4 cancer, when the survival is overall much, much worse. And what we can do about changing, about finding early, we're going to talk about that in a little bit. Lung cancer nationally, it is the biggest it is the 3rd biggest cancer in the U.S. It's only behind breast cancer and prostate cancer. But it is the far and away the largest cause of cancer-related deaths, with 125,000 people who died of lung cancer last year. Now, although that's a national figure, in Tennessee specifically, lung cancer is actually the most common cancer. It is actually more common than breast cancer and more common than prostate cancer in the state of Tennessee. Every day in the state of Tennessee, 17 Tennesseans are diagnosed with lung cancer, and 11 people will die from lung cancer in the state of Tennessee. Our lung cancer rates. So we can see this is a state ranking, how we compare to other states, green being the average. We are not doing very well. We are 47th in the nation in terms of lung cancer. We are the 3rd or 4th highest in the entire United States in terms of lung cancer rates. Why that is? Because we smoke. We smoke at a much higher rate than the rest of the country. Our smoking rate is about 18.5% overall in the country. It's about 11 to 12%. That being said though, even if that we took all smokers out of the equation, lung cancer is still a major problem in this country. Non-smoking lung cancer is still the 8th most common cancer in this country. Lung cancer is one of the few cancers where you get blamed for having your cancer. Like for example, like breast cancer, there's an association that if you don't, people who have fewer children are more likely to get breast cancer. Or people who eat, red meat are more likely to get colon cancer. I don't say you ate too many hamburgers, you deserve to get colon cancer. If you didn't have enough kids, you deserve to get breast cancer. But we do that all the time with lung cancer. We say, you smoked, you deserve to get lung cancer. And we need to change that stigma. How I look at it now is lung cancer is right now where breast cancer was 30 years ago, where no one wanted to talk about it. We did a really bad job of treating it, but then someone out there, a group of people got out there and said, we need to do something about it differently. And we can do something about it differently, and the survival for breast cancer skyrocketed. And we can do the same thing now with lung cancer, change that. How we do that is we start by talking about lung cancer. This is an event, we had a lung cancer education event in the hospital on October 29th. Tim Burchett there, we actually let him use the robot that we use to diagnose lung cancer. The little kids did way better than him, but that's okay. This is Dr. Glenn, my partner. She's here on WJBE talking to the radio host, specifically talking about lung cancer screening in the African American community in Knoxville. And then this is our mega lungs event, part of the same thing. We had all this with these giant inflatable lungs talking about lung cancer. Lung cancer screening, this is what's so important. I hope that you guys take away this from the talk. There were 2 landmark trials in the early 2010s that showed that there was a 20% or greater reduction in your rate of dying or risk of death dying from lung cancer if you got a low-dose CT scan compared to chest x-ray. In women, it's actually a higher benefit. It's actually up to 40%. And actually, the other important thing about these studies were so good, they were stopped early. If they had actually followed after their original endpoints, the actual rate we probably would have seen would have been higher. Our current guidelines for who should get smoking, age 50 to 80, current cigarette smoker equipped within the last 15 years, and then a 20-pack year history or greater of cigarette smoking. I'm very happy to say that as Director of Lung Cancer Screening, we're actually doing a lot better job screening in this area. In 2022, we screened 1,500. Last year, we screened 2,069 people, and this year we're on track for about 3,400 people screened in our system, which is about a 60% increase from last year. If you know someone that needs lung cancer screening, if you have them call this number. This is a real live person that you will get, our lung cancer navigators. They will work with that person, they will work with their PCPs, and they will help them get screened for lung cancer. And I've also got some flyers over there if you want to take a flyer at the end of all this too. that was the bad part of the talk. Now we're gonna talk about the good part of the talk, okay? Things that we're doing here differently, okay? Mobile lung cancer screening. I'm proud to say that we recently got an HSDA grant, a grant from the federal government, to actually build our own mobile lung cancer screening unit. Basically a bus with a CT scanner on the back that will go out to rural areas and get people screened for lung cancer. Because the idea behind it is that we want to catch lung cancer early. This is the bus that they have down in Chattanooga. This is what it looks like on the inside. Couldn't be any simpler. They walk in through this door, someone registers them, they walk inside, they get their CT scanner, they walk back out. It takes about 7 to 15 minutes for the whole thing. And then they get a scan, they get to know an answer there. What's the best medicine for lung cancer? It's surgery. I have it myself, okay? That's what we want to do. We want to catch cancer early so we can treat it. On that screening scan that has a 1 centimeter cancer, used to be 10 years ago, we said we can't biopsy it, we don't know how to get to it. Or you have to get a needle in through the outside of your chest. We have a much better system now with a much lower complication rate. Dr. Bevel, my colleague, unfortunately couldn't be here because he's actually probably doing this right now, is we're doing robotic bronchoscopy. And what this is, it's basically a fancy robot arm that goes down through someone's airway. They go to sleep, they're completely comfortable through the whole thing. It can actually have a little telescoping arm on it that's based on airplane technology, so it actually senses the shape that it's changing, and it can actually get out there to the small peripheral lesions and biopsy them and diagnose them. A new technology that we're using here is something called a drug called Silex paclitaxel. How this basically works is the patient's cancer expresses an increased amount of folate receptor. They get a preoperative IV infusion in the preoperative area of this drug. It then accumulates at the folate receptors of the cells, and then I use a special camera in the OR. And I know you guys aren't medical, so I didn't put the video in here, so they don't want to gross out anyone during the lunch. But this is literally someone's cancer glowing during the operation that I get to just see it and cut it out. Comprehensive biomarker testing. This is, what I said, that side part about, and medicine too. This is the other part that's really actually changed the treatment for lung cancer. And this is a really big deal. Immunotherapy, which came out in about 2015, has really changed the game for lung cancer and really increased people's survivals. And it's a big part of why that is that it's basically finding like a lock and a key. We find what's the lock on the cancer, and we put the key in there, we make the cancer go away. So in conclusion, lung cancer is the most common cancer and the biggest cancer killer for Tennessee, and decreasing smoking is essential. We need to get rid of the stigma around talking about lung cancer. Screening saves lives. Get screened, get your friends screened, get your family screened. Lung cancer treatment has changed drastically in the last 10 years, and I see this all the time in my clinic where I get someone who says, my dad had lung cancer. I'm like, well, when did your dad have lung cancer? 40 years ago. It's a completely different ballgame. The chemotherapy is completely different. The immunotherapy is completely different. The surgery is completely different. Back then, everything was open surgery, in the hospital for a week and a half kind of thing. I can do a lobectomy and send someone home the next day with it. So we've got lots of different options here. Lots of new options for treatment of lung cancer, all stages. There's lots of work to do, but there's lots of reasons for hope, and survival is going on. Thank you very much.